Namaskar, West Bengal. Today, I'm going to address the Chief Minister of the state on a few issues, and I want the people of West Bengal to listen to this audio. Before I begin with anything, I would request all the people of West Bengal to stay safe and to stay at home. This is a very difficult time for India and West Bengal, and the only thing we can do is to stay at home and be safe. I start this session with a parody. Ding dong bell, people in the hell. As COVID strikes one, the audit says none. Ding dong bell, people in the hell. Chief Minister, you said in one of your letters that you are the Nirbachito Mukhyamantri. Let me remind you that you were elected an MLA and your party selected you as the Chief Minister, and after becoming the Chief Minister, you nominated yourself as the Health Minister and the Home Minister of the state. So in effect, you are a self-nominated Health Minister and a self-nominated Home Minister. And from that perspective, let me tell you that today, West Bengal has the highest percentage of death in COVID-19 cases with 11.09%, and the state stands first in morbidity rate. This state also stands last with the lowest percentage in testing of COVID patients. For the viewers, I would present a chart where the morbidity rate or the percentage of death of COVID cases in relation to the total COVID positive cases will be seen. Delhi has 2.11, Maharashtra has 4.42, and so on in the list, and you will find a long list of states, and you will see that West Bengal is an outlier with 11.09%, and under the able leadership of the Chief Minister, we have achieved the first position in India in respect of morbidity rates. While the state stands first in death percentage of COVID-19 patients, we saw Tikiapara incident in the red zone of Howrah today, where the state's law and order machinery has completely failed. Police has taken the beating, but this is not the first time. In your regime, Chief Minister, police has taken the beating many times before, and today's situation was no exception. This state has failed to give a 100% lockdown even in a serious crisis like Corona. And you yourself has diluted the lockdown by opening shops of non-essential items and by giving long ropes, really long ropes to some people so that they could do whatever they wanted to do. And today we saw the effect. Some days before, sensing danger, you yourself went out to broadcast that social distancing norms should be respected. So this is your achievement, Chief Minister, as the Home Minister of the state, that your law and order machinery completely breaks down and the guardians of law becomes the victim of public wrath. Sufficient time has passed and we have not seen strong action on your part. Chief Minister, you have not given sufficient protective equipments to the healthcare professionals. No sufficient quantity of N95 masks, no gloves, no gowns. And the doctors and the nurses and other healthcare professionals are bulldozed into attending the patients. And every day we see that a number of doctors are getting affected, and a couple of very respected doctors have passed away, being attacked by COVID-19. This is your achievement as Health Minister. Today, we find an absolute lack of transparency and the figures of death of COVID-19 are manipulated and suppressed, and the district administrations of the various districts have become involved in this political game, I will ask the viewers to see a few correspondences in this regard. Chief Minister, you also gave very disrespectful exit to the people who passed away with corona. Some of the bodies are lying unattended in the Sarkari hospitals, while many bodies have been taken away to faraway places, even to jungles, and burnt with disgust, disrespect, and disdain, while the souls cry in indignity. Their family members are hurled away like wild animals to the isolation wards of the Sarkari hospitals. The said isolation wards are third-rate category hospitals where the cats loiter in the toilets, no hygiene, no basic minimum facility, and this is your credit, this is your achievement as health minister. Your police starts FIR against whoever raises a voice against your government, and the audit committee generates fancy figures of corona deaths in gross violation of the WHO and the ICMR guidelines. May I ask you, Chief Minister, why was the audit committee constituted? India did not see any audit committee, nor did this state, even when we passed through dengue, we passed through polio. There was no audit committee since independence. Why was this committee constituted? What was the need? Was it that the state government did not have confidence on the doctors treating the corona patients? Was it a lack of confidence? Or was it for political gain? Was it to project an image of yours larger than real life? That the Chief Minister of West Bengal is the only person in India who can fight corona successfully by keeping or hiding the figures of corona death at its lowest? And since you have constituted this audit committee, who are the constituent members of this committee? Are they forensic experts who are better than the doctors who are actually treating the corona patients? Have they any other better qualifications? Are they corona specialists? Are they specialists of SAR? And did the Chief Secretary of West Bengal ever officially announce that there were 57 people affected by corona, out of which they have declared 19 as corona deaths? No, Chief Minister, you can't answer any of these questions because there are no answers. Let me tell you that hiding the real cause of death is a criminal offense, and that too in 39 cases in gross violation of ICMR and WHO guidelines. And this could lead you to a very prolonged legal battle and loss of public image, the same image which you wanted to brighten by lowering or hiding the number of corona deaths. The medical fraternity is unhappy, but you know that. The non-resident doctors have written to you stating that not reporting COVID-19 as the underlying cause of death amounts to falsification of data. And today, India has a reasonable percentage of tests, while West Bengal's tests are at lowest. In terms of ratio, West Bengal has conducted 34 tests per million, whereas the national average is 156.9 tests per million. And the highest morbidity rate is due to gross undertesting, misreporting of data, and also a completely failed lockdown in the state of West Bengal, which has ensured quite a high rate of spread of the disease. Chief Minister, these are your achievements as Health Minister and Home Minister of the state. And while all these are happening, parallelly, the public distribution system has totally failed down. In fact, the PDS has been hijacked by the Trinamool Dadas, and all the essential items which were given by the central government for relief has gone to the go down of the Trinamool party workers. We find the breakdown of law and order on one hand. On the other hand, we find third-grade hospitals. And coupled with this, we find that people below the lower income group, people below the poverty line, those people are not getting essential items in the state. So we say, ding dong bell, people are in the hell. And, Chief Minister, you will surely go down in history as one who constantly bickered for power, authority, and publicity, who bulldozed the press so that they keep quiet, who bulldozed the healthcare professionals so that they go and attend patients without security, without personal protection equipments. You will go down in history as one who, being a home minister, could not ensure 100% lockdown in the state, as whose healthcare system did not operate, and finally, who could not give relief to the poor and the needy. Chief Minister, these are your achievements. We congratulate you and Namaskar, Nirbachito Mukhyamantri.